Hi everyone, welcome to my channel. My name is Fatima. This is Hacking Life with Sickle Cell. Let's get right into it. So as you can probably tell from the title, might be somewhat controversial topic or uncomfortable for some people to talk about or deal with. I know it's not only people with sickle cell that struggle with this, but there are so many other people, so many groups who struggle with being classified as drug seeking or addicted to opioids. As we know, there's a huge opioid crisis all around the world, really, but the United States is the hub of it. It's the center of this opioid crisis. I mean, we all know by now how the big pharma and huge companies flooded the market on OxyContin, and both long-term and short-term OxyContin, and hydrocodone, Percocets, and these horrible medications. So this all started in the 90s, and then with the flood of pain medications and doctors openly prescribing pain medications for everything, people started to get addicted to it. And I want to talk about how this affects us, people struggling with sickle cell disease, because no one is denying that it's a problem, that drug abuse, we all know it's rampant. It's probably in everybody's neighborhood all across the United States. But my concern is, as someone with sickle cell disease, as someone who depends on these medications when I'm having a very acute pain crisis, a very serious pain crisis, and then going to the emergency room, I'm sure I'm not the only one who has experienced, how do I say this nicely, very interesting doctors and their opinions about my pain management. I would hear the craziest things from people, like, you don't look like you're in pain, you're able to talk to me fine, or I know it's their job to do their due diligence and to make sure that just not everybody gets pain medication who asks for it. But I just think that if you look at my chart, and I have a confirmed sickle cell disease from a certified doctor, that I should be able to just get the basic treatment that my doctor has said that I should get when I'm in this pain crisis. So I just want to note, like, what are your experiences with sickle cell disease and asking for pain medications? Are there times you were denied pain medication? How do you navigate that in the ER? For me personally, I have a couple, 3 tips that I use to help when I go to the ER in a pain crisis and I need these strong drugs. First tip is to always go with documentation from a doctor on certified paperwork, like with their letterhead or on a pain prescription. Talking about what happens, your care, if you have a crisis, especially if you're in a new city or in a different hospital where they don't have access to your paperwork or access to, the hospital database. So let's say you're on vacation, you live in Alabama and you're on vacation in California, and you're going to be there for more than a couple of days. I would highly suggest that you go with some sort of documentation from your doctor with all their contact information, email, phone number, and office number, and just steps of what happens when you do have a pain crisis. What fluids do you take? How much of the fluids do you take? What both narcotic and non-narcotic pain treatments should they administer when you're at the hospital? Do you get oxygen? Do you usually need a transfusion? Just list that out. Just have that. It doesn't hurt to have it. You may never need it. That's great. Or you may really, really need it. Second tip, I would say, is to check ahead. Just wherever you're going, just make sure that you know the hospital you might have to go to if a pain crisis were to occur. Due diligence, maybe even introduce yourself and say, hey, this is what's happening, call the ER. What should I do if I do have a pain crisis? Just call ahead. It doesn't hurt. They might think you're crazy. You might not need it, but it's better safe than sorry. 3, it's going to be hard, but do not go in your pajamas. brush your teeth, get dressed, have proper hygiene, and look presentable. I don't know how to say it without sounding mean, or controversial. It's a sad truth that most people with sickle cell disease in the United States are Black Americans. So being Black in this country, we know that there are a lot of stereotypes and a lot of judgments that come with our dark skin. So although doctors and nurses will always say like, oh, I don't see color, blah, 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 blah. We know what's up. We know that they do. And we know that everybody, not just doctors and nurses, every human being makes judgments like this, makes snap judgments. They don't know why, how, or they might not even be able to say it, but we look at someone, we assess them, and we make judgments. So when you're going to the ER, make sure, especially with a hospital that's not familiar with you, that doesn't know you, make sure you brush your teeth, you look presentable. No one's saying you have to wear designer clothing and look fresh to death. We're just saying be presentable, be clean. And then when that does happen, because that matters, your presentation really, really matters. One, get paperwork from your primary care physician or your hematologist. Two, make sure you call ahead and check in and make sure what the procedure is for that ER wherever you're visiting in case you do have a sickle cell emergency. And then three, be presentable. Brush your teeth, don't smell funky, and wear clean clothes. Be presentable, because we know everybody has biases, and the less biases are against you, hopefully the quicker and faster you can get treatment. Good luck with that. I hope none of you ever have to experience that, and stay healthy.